As a woman, have you experienced the itch in your vulvovaginal area that has been beyond belief? You haven't? Well, keep living in the body of a woman and you will soon know exactly what I mean. Hi ladies, I'm Dr. Kady, a board certified family doctor. Welcome to Hey Doc. On this channel, we talk health topics, but in particular, we love anything to do with women's health and fertility medicine. So if this type of content tickles your fancy, consider subscribing and smashing the like button. Right, without wasting any more time, let's dig deep into today's matter. A lady's pet bear, vulvovaginal itching. Let's do a bit of stats, shall we? Did you know that 5 out of 6 women have experienced vaginal thrush in their lifetime? That means it's an extremely common condition, which is a reason why I said, if you haven't experienced it before, keep living. Because it is extremely likely that at some point in your life, you also will experience vaginal thrush. At the very minimum, most women will experience at least 2 episodes of vaginal thrush in their lifetime. So the question is, have you had it? And most importantly, for those of you who have clicked on this video, I'm sure you are intrigued about how to stop yourself from getting it and doing that very embarrassing vaginal dance, especially whilst in public. Specially designed for you ladies, we will be talking about all things vaginal thrush, vulval itching, and at the very end of this video, I will be going into details about what you need to do to prevent yourself from getting vaginal thrush or vulval itching over and over again. I hate assuming that everyone knows what we are talking about, especially when we use specific medical terms. So in each episode, I always endeavor to make sure that I define the key medical term that we are addressing in that video. In this video, I want to get the definition of what vaginal thrush is out of the way early. Vaginal thrush is actually a fungal infection that affects the vulval vaginal area, and it's caused by the overgrowth of a fungal species known as Candida. There are various different strains of the fungus known as Candida, but the most common species to affect the vulvovaginal area is Candida albicans. Candida albicans is responsible for 80 to 90% of cases of vaginal thrush. You can have Candida only in the vagina, and that's called vaginal candidiasis. You can also have Candida only in the vulval area, and that's called vulval candidiasis. Or you can have Candida albicans affecting both areas at the same time. Are you a little bit confused? Okay, this is the vulval area, and only this part is the vulval area. This part is not the vagina. This part, on the other hand, this collapsed tube that extends internally, is the vagina. Okay, I can't help you in this video. It's just not going to be possible for me to address all of these details in this video. You're going to have to check out the video that we have on this channel, which is called Know Your Vagina. In that video, I talk in great detail about the different parts of the female intimate anatomy and their functions, as well as looking at different conditions that can affect different parts of the female genital area. So make sure you check out that video to understand more about the female genital area. Hey doc, how did I get it? That question I've heard over and over again from my patients. They come up to me and say, Dr. Kady, hygiene down there is tip top. Like, I look after myself, you know, there's nothing fishy going on. I've got the same sexual partner, you know, why is this happening to me? Right, let me address that concern once and for all. Now that we know what vaginal thrush actually is, let's talk about how you can get this fungal infection. Candida is a natural occurring organism that occurs in all vaginal flora. Yes. including your vagina. However, various factors can disturb this delicate balance of microorganisms that exist in the vaginal area. What then happens is that there is a change in the pH of the vagina, which should be at a slightly acidic pH, eventually leading to the overgrowth of candida, leading to you developing symptoms. Common factors that lead to the disruption in the balance of the microorganisms that exist in the vaginal flora include: the first factor has to be the use of antibiotics. So antibiotics are great at killing bad bacteria, but sadly, sometimes they do not distinguish between the bad bacteria and the good bacteria. And when we talk about the vaginal area, the good bacteria is lactobacilli. Antibiotics disrupt the natural vaginal flora by killing off lactobacilli, thereby causing the fungus to overgrow opportunistically. Having a weakened immune system will make you more susceptible to developing vaginal thrush. For example, if you have conditions like HIV or AIDS, going through chemotherapy, taking certain medications that suppress your immune function, like being on high dose of oral steroids, or the use of other immunosuppressant medication, for example, in patients who have had organ transplants. If you are pregnant, the hormonal changes affect the delicate pH balance that is found in the vagina, which in turn leads to the disruption in the microorganism balance that is found in the vaginal area. As a result, vaginal thrush is a very common occurrence in pregnant women. Poorly controlled diabetes means that the high sugar concentration is also found in the vaginal fluid, and fungus tends to thrive in environments where there's humidity, moisture, and also high sugar content. Having sex with a partner who has thrush around the glans of his penis or underneath his foreskin. But a word of caution: thrush is not an STD. You may be sexually intimate with someone who has thrush. That doesn't automatically mean that you will also get thrush. So just be aware that thrush is not an STD, but that doesn't excuse the need for you to practice safe sex at all times. The use of irritating feminine products like soaps, bubble baths, vaginal douches, and many other products that are marketed for feminine hygiene actually disrupt the natural pH balance that is found in the vagina. This leads to a shift in the pH of the vagina to being more alkaline. And when the vagina is in the alkaline state, it increases the risk of infections, including leading to vaginal thrush. Wearing tight and non-breathable clothing, especially around the genital area, creates a warm and moist environment, which is ideal for fungus to thrive in. Let's get into the symptoms, shall we? The first blatant symptom of vaginal thrush is itching. Itching is more common in the vulval area. You can also feel itching inside of the vagina, but that symptom is less common in comparison to feeling the itching in the vulval area. Itching can sometimes be so intense that it leads to very small cuts in the very delicate skin that is found around the vulval area and inside the vaginal wall itself. Don't ever underestimate the power of the itch in vaginal thrush. I mean, it can be so debilitating that some patients just can't go to work. Not to talk of having sex, especially when the woman starts to experience those small cuts in the vulval area. The last thing on her mind is for her to be sexually intimate, not to talk of the knock-on effects that it can have on her marriage. So don't let it get that bad. Just see your doctor. Next, let's talk about the texture of the discharge that is very often, but not always, associated with vaginal thrush. It's very often thick, white, and you can describe the consistency of the discharge that you get as a little bit like cottage cheese. It's thick, it's clumpy, and also this would be a good place for me to talk about the odor that you perceive with vaginal thrush. Though not always, vaginal thrush may not have an odor. So it may have this fermented yeasty smell, or it may have no odor at all. The bottom line is the odor that occurs in vaginal thrush, if at all, is really not an offensive odor. And before we move on from the discharge, the fact that you're not getting any discharge doesn't necessarily mean that you do not have thrush. Not everyone who has vaginal thrush actually gets a discharge. The vulvovaginal area can become sore, plus or minus a burning sensation. Let me explain. The symptoms of having a sore vulva or a burning vulva will often depend on how long you've had the symptoms for. If you've had the symptoms for quite a number of days and you've continued to scratch and it's led to small cuts, it will feel sore. But the burning sensation that some women describe comes from the fact that they have developed small cuts in those areas, and those small cuts obviously are obviously open, and when they pass urine, it burns. Or they've itched so much and have so many of these and develop multiple small cuts, and so they have this constant burning sensation that results from the inflammation of scratching that area so intensely. In a small percentage of women, the vaginal thrush is so severe that it leads to significant redness as well as swelling in the vulval area. But I will say that in my many years of practice, I've only ever seen this happen in about 2% of cases of vulvovaginal thrush that I have treated. And in these women, I've had to put them on antifungal medication for an extended period of time. So the symptoms of significant redness and swelling tends to only happen if you've left it untreated for a long period of time. And so the fungus has gone deep into the skin tissue, which leads to the swelling and the redness that can be observed in that small percentage of women. How do you confirm whether or not you have vaginal thrush? What test do you need to do? Let me help you save money, ladies. Most of the time, you don't actually need to be tested to confirm whether or not you have vaginal thrush. It's such a common condition, and many women will have had it several times in their lifetime. And by knowing what the symptoms of vaginal thrush are, all of which I've just described, and knowing your own body as a woman, you can actually diagnose yourself with vaginal thrush. And therefore, you go and get the treatment, you get treated, and very often that's the end of that. So you don't actually need to go and buy a weird and wonderful kit from the pharmacy or even pay to see your doctor. You can treat yourself. That's why, ladies, sometimes when you go to your doctor with symptoms of vaginal thrush, he or she will just give you the treatment and that's it. But I know that certainly some of you ladies, when you have gone to see your doctor with your symptoms, you felt that your doctor was a little bit negligent because he or she didn't examine you to confirm that you had vaginal thrush, but just gave you the treatment and sent you on your way. You felt that you weren't cared for and that your doctor probably didn't do a very good job. Some of you actually felt that your doctor was actually lazy, but that's another matter. Now, let me help you to understand why it is that when you go and see your doctor for symptoms of vulvovaginal itch, especially the first consult with that particular episode, why your doctor may not examine you. If you go and see your doctor for symptoms of vaginal thrush that is bread and butter, clear cut, we know what's going on, and your doctor examines your vulvovaginal area, only to have a look and see, okay, yes, there's some white discharge, but remember the redness and the swelling doesn't always happen. Remember, redness and swelling only happens in very severe cases and when the condition has been left untreated for a very long time. So most of the time, there really is nothing to see. And also remember that the discharge doesn't always happen. So if your doctor tells you to, allow for him or her to examine you down below, but it's not going to do anything, it's not going to change what he or she does, would you agree that that would be invading your intimacy when there was no need to? Because that examination is not going to change what he or she does. Ultimately, they would still prescribe medication for you to be treated for vaginal thrush. And that is why you can walk into a pharmacy and buy treatment for vaginal thrush yourself. You don't actually need to see a doctor. So don't be upset if you go to see your doctor and he or she doesn't rush to examine you. It's perfectly fine, especially if you present for the first time with that episode of vulvovaginal itch. But I saw this kit in the pharmacy and it says that I can use it to confirm whether or not I've got vaginal thrush. Should I buy it? Should I buy it? My question to you is why? Why waste your money? Save that money and use that money rather to buy the treatment for vaginal thrush. After all, these things are not cheap. If you are going to need to be tested for vaginal thrush, it's advisable that you get that done with your doctor rather than, buy those kits from the pharmacy. I know some pharmacists are not going to like me. When it comes to treatment, the first thing that we should say is that you do not always need to take medication to treat vaginal thrush. That's true. In the same way that vaginal thrush developed because there was an imbalance in the microorganisms found in the vaginal flora, in that same manner, the good bacteria, which is predominantly lactobacilli, can start to overgrowth and overtake the number of candida, restoring the microorganism balance found in the vaginal flora and in turn the pH returning to its slightly acidic nature. That's why you may have noticed that you get a slight vaginal itch for a couple of days and either you've been too busy to get any treatment and then you realize that without having taken medications, the symptoms die down. And the restoration of this natural microorganism balance can take 3 or 4 days. So I advocate that the first way to try to treat vaginal thrush is with time. Be conservative and see if your body will be able to fight the candida overgrowth by itself. Beyond 3 to 4 days, if your symptoms persist, but most especially if they become more intense, you should go to your pharmacist, describe your symptoms, and in most countries, most pharmacists will be able to sell the treatment for vaginal thrush over the counter, thereby allowing you to again save money on your doctor's bill. Treatment for vaginal thrush come in 3 different formulations. The first is the cream. The main active ingredient for the cream formulation is clotrimazole. If your symptoms are in the vulval area, remember, we said this was called vulval candidiasis. You would apply the cream to the vulval area 3 to 4 times a day for about a 7-day period. There are also intravaginal cream. Basically, this cream formulation is put into an applicator. So you will squeeze the cream into the applicator. Usually it ends up being about 5 grams. You will insert this applicator containing the cream into your vagina with the aim of delivering that 5 gram of clotrimazole cream into your vagina. Again, the doses vary from patient to patient, and that is when you should speak to your own doctor. The second formulation are vaginal pessaries, and for these, again, the active ingredient is clotrimazole. There are different strengths of vaginal pessaries which will affect the duration of the treatment. So, for example, if you are using 200 milligram pessaries, you will insert 1 pessary into your vagina every night for 3 nights. If you're using 100 milligram pessaries, you will insert 1 pessary into your vagina every night for 6 nights. And the biggest dose is the 500 milligram pessary. And for that pessary, you use it once over 1 night period only. So you see, the doses are different. Again, what would Dr. Kady say? That's right. Speak to your own doctor. The reason why the pessary is to be used at night is simply so that it doesn't leak out whilst you're out and about during the day. The third and the last formulation of the treatment for vaginal thrush is the oral formulation. But with this formulation, the active ingredient is fluconazole. Ladies, if you are trying to fall pregnant, or if you are pregnant, the oral formulation is simply out of bound for you. The oral treatment is a one-off tablet. Ladies, word of caution. If you take the tablet, it's not a magic pill. It will take time. Give it 2, 3, or at times even 4 days after taking the tablet to conclude it has not worked. You may still experience some itching a day or 2 after taking the tablet. It's perfectly fine. Just be patient. As good as you may have become in recognizing the symptoms of vaginal thrush, and as easy as the access to the treatment for vaginal thrush has become, there are simply some times when it's just not safe for you to continue to self-manage your symptoms of vulval itching. This is especially the case when there are other conditions that can also cause vulval vaginal itching. And so you might be thinking the whole time, not being medically trained, that you actually have thrush, but the whole time it's another condition that you are dealing with, and you are wasting time by continuing to go to your pharmacist and getting this medication without actually seeing your doctor and being properly examined. If after taking the over-the-counter medications once, twice, it hasn't worked, the next step should really be you seeing your doctor. So the red flags that should cause you to go and see your doctor about vulval vaginal itching that is not settling despite having taken over-the-counter treatment, having had several episodes in a short period of time, having had sexual intercourse with a new partner, whether you had sex with or without a condom, because the vulval vaginal itching symptoms that you may be experiencing may not be thrush, but rather an STD. Other important red flags will include pain in the pelvis and bleeding from the vulval area or the vaginal area. Vaginal thrush will hardly ever cause you to bleed unless you are literally scratching away at your skin because it's so itchy. And even if that's the case, that tends to mean that the vaginal thrush is so severe that you need to see your doctor anyway. So if ever you think this is vaginal itching, but you're seeing any form of bleeding, that should be your cue to see your doctor immediately. And finally, another reason why you should see your doctor if you have failed to respond to over-the-counter treatment. Now, I mentioned this before, but let me explain and give you a bit more detail. You should go and see your doctor if you have failed to respond to treatment over the counter on 2 different occasions. In my opinion, this is when your doctor should be examining you. Remember, this time you are not presenting to your doctor with the first episode and you've not tried anything. It's very clear that it's vaginal thrush and you've presented to your doctor about it the first time. In this scenario that I'm talking about now, you have tried something over the counter, whether it's the same formulation or different formulation over the counter. You've at least tried twice and it's not worked. Your doctor should be examining the vulval area. Is it red? Is it swollen? Is it bleeding because there's small cuts? Or is there an odd lesion that is not very classical of vaginal thrush? Remember, vaginal thrush will not cause a distinct lesion or a distinct one-sided rash. It will tend to be spread all over the vulval area. So this is the only time I feel that it's appropriate for your doctor to invade your intimacy, because at this stage, when your doctor is examining your vulval area, he or she should be taking a swab at this stage. If the swab comes back as positive, then it may well be that your doctor might need to put you on oral fluconazole for slightly longer than just the 1 day. I have had to put my patients on oral fluconazole for vulval candida for a month because it was quite extensive and it was quite severe. But again, I will leave you in the trusted hands of your own doctor. So this will lead very nicely to the question I've at times gotten from some of my patients. They have continued to have a problem with vaginal thrush happening over and over again, and they wonder whether their partner should be treated at the same time as them. What my answer has been is that we need to rule out all the possible reasons why you as my patient being the woman, why you might be getting vaginal thrush over and over again. Once we've ruled out all of those causes and we just cannot simply find why she continues to get vaginal thrush. Remember, for these ladies, I would have done a swab, and especially if it continues to happen, another reason why your doctor should do a swab is because it keeps happening over and over again. So once we've done the swab and we've confirmed that you continue to get vaginal thrush over and over again, then it wouldn't be such a bad idea for the partner and the woman to be treated together. And during the times when they are being treated, they should both abstain from sexual intercourse. And once they've completed the course, I tend to encourage my patients to wait a couple of days before becoming sexually intimate again with her husband. And finally, the bonus for all of you wonderful ladies who have stuck with me right through to the end of this video. So what do you need to do to prevent yourself from having thrush over and over again? Reoccurring thrush, basically. After passing urine, you must get used to the technique of wiping yourself from front to back. This will prevent the transfer of the candida that may sometimes be around the anal area from coming into the vulvovaginal area. You must avoid all forms of scented toilet paper and menstrual product because, again, these things affect the natural pH balance of the vagina. If you are someone who tends to experience vaginal thrush after you've completed a course of antibiotics, what you might consider doing whilst you are on the course of antibiotics and for a couple of days after you completed your treatment course is to take a probiotics. There are many probiotics out there that will support a good microorganism balance found in your vaginal. Avoid wearing tight clothing and synthetic underwear. I do encourage you wear cotton underwear because that absorbs the moisture, removing one of the elements that cause fungus to thrive, and that is moisture. And by not wearing tight clothing, you avoid warmth. Again, that causes fungus to thrive. Stay away from feminine hygiene products that are antiseptic, vaginal douches, or feminine type of personal spray for down below. Stay clear of all of these. You don't need them. Also, stay away from using regular soaps to clean the vulval area because they will affect the pH of the vulval vaginal area, pushing it to being more alkaline, and this promotes infection. But rather, what you need to be using is to consider soap substitutes if you must use a soap at all. Some people just use water. Whatever works best for you, but the bottom line is you don't want to be using regular soaps to wash the vulvovaginal area. That is all that I have for you for this episode of Hey Doc. I hope it's been informative, you have enjoyed it, you've learned loads, and that you would consider subscribing and sharing with others so that we can grow this health community known as Hey Doc. I look forward, as always, to seeing you in our next video. But in the meantime, there is loads and loads and loads of material for you to indulge in and improve your knowledge of fertility and women's health. We will see you in our next video, and you know how it is.